I'm Logan Crawford, and this is the award-winning TV talk show right here on Ebru Fresh Outlook. We begin today with a look at an Ebola outbreak, a limited one, albeit, in America's largest city, New York. Here is more.
New York City has its first Ebola case. Dr. Craig Spencer with Doctors Without Borders returned from West Africa and tested positive for the virus on October 23rd. The city feels ready to tackle the case.
We have an abundance of equipment, abundance of training, abundance of experienced professionals.
We want to state at the outset, there is no reason for New Yorkers to be alarmed.
But the patient's neighbors are still on edge.
We're just shocked, We don't expect that, what you gonna do?
Spencer's two friends and his fiancée are quarantined. They are doing well, as is the Ebola patient. Health officials have already checked and cleared a coffee shop and a bowling alley visited by Spencer. Elsewhere, at a House Oversight and Government Reform Committee hearing, this was the plea.
No nation would ever contemplate sending soldiers into the battlefield without armor and weapons. Give us the tools we need. All we ask from President Obama and Congress is not one more infected nurse.
Speaking of nurses, Nurse Nina Pham has been declared Ebola-free and even hugged the president. Earlier, she spoke to the media.
I would especially like to thank Dr. Kent Brantley for his selfless act of donating plasma to me. As a nurse, I have a special appreciation for the care I've received from so many people. Not just doctors and nurses, but the entire support team. I believe in the power of prayer because I know so.
We are back live now here on Fresh Outlook and talk more about the Ebola outbreak in New York City. A doctor infected with the disease is Mayor Felix Roque, mayor of West New York, New Jersey. Albert Goldson, president of Indo-Brazilian, which is a global financial advisory firm. And joining us live via Skype is political psychologist Dr. Bart Rossi. Dr. Roque, I'm going to begin with you. Another physician falls ill with Ebola. I know you don't know exactly how it happened, but how do you think it happened?
I would say that he might have been a little careless. And I'm going to say first that we have probably the best medical system in the world in the United States. Doctors are very well trained. We have the best hospitals and the best training there is in the world. But at times people do make mistakes, and this is a result of a mistake.
He rode the subway, he took a taxi, he went bowling, he ate at a restaurant. Do you think he was negligent, knowing where he had been and who he had dealt with?
I was not going to say negligent, but I think he might have been, he didn't know how serious his situation was.
Albert Goldson, let me turn to you for just a second. We hear now that the governors of New York and New Jersey are imposing a mandatory quarantine on people who have been exposed to Ebola, who are returning to the United States, nurses, doctors, and so on. Good idea, bad idea? What are your thoughts?
Well, it's definitely a good idea because you have to present some type of protection as far as the public is concerned for travelers who have gone through that region. Of course, it's not perfect, but as we gain more information as to how to detect those coming in who are symptomatic, then we can refine those rules as far as travelers are concerned.
When I heard that the governors of New York and New Jersey were doing this, I, as a concerned citizen, applauded them. Because I feel if you've had direct contact with somebody who has Ebola, you need to be watched closely for the incubation period to make sure you don't have it before you get on a New York City subway. And I felt finally we got some leadership. Let's turn now to Skype and Dr. Bart Rossi. Doctor, we're talking about the situation of Ebola in New York City, and since people are literally elbow to elbow in New York City, it's a frightening place to even have one person infected.
Well, it is. It's a frightening situation, but what I take out of this is the political psychology of fear. And I think the politicians are making this too big a deal for their own advantages. And what I mean by that is Ted Cruz actually criticized the president for listening to his experts, and the president decided not to impose a ban on travel because he could then monitor people better. And I say that Ted Cruz would be on the other side of this issue if the president ignored his experts and basically said, well, we're going to ban the flights because the optics might look better. So I think that the politicians are really the ones hyping this, and I think there's too much of a fear factor, although we know that this is obviously a serious situation.
All right, Dr. Rossi, I'm going to stop you there. Albert, you're a pilot as well. What do you think about banning flights?
Well, no, they have to continue the flights. What most people don't realize, there are no direct flights from West Africa to the United States. In fact, there are only 2 commercial airlines that are flying into that region, which is Brussels Airlines and Royal Air Maroc. Those flights usually go through a transit point in Europe, and from that point come to the United States. And it's very possible that someone who has been in the area, medical personnel, are asymptomatic to get on an aircraft, go to Europe, and then make that transfer and come to the U.S. So again, it's very difficult to pick up passengers that are entering the U.S. if they're asymptomatic and then develop symptoms after they arrive. But nonetheless, I still believe that there should not be a travel ban, but there should be some protocols in place for those people who have been in that area.
And it looks like they're coming, albeit perhaps too late in the situation in New York City. Doctor, I'm going to turn to you because you wear 2 hats. You're not only a doctor and surgeon, you're also the mayor of West New York, New Jersey, which is perhaps one of the most densely populated cities in America. You, as a leader of this municipality, what are you doing to keep your people safe?
It's all about education. It's all about being prepared. And education, I believe the media is doing a fantastic job. Yes, there is a little bit overhype of the spread of the disease, and we know that other diseases, malaria, dengue, polio, has killed more people than Ebola has. But at the same time, we got to prepare. And I agree, our local government is working with the county. We're closely monitoring the patients in my town. And we're working with the local EMS and the police department, and again, education and being prepared. So I don't believe, again, we have the best healthcare system in the world. I don't believe it's going to be as spread as what it is in Sudan and Zaire right now. I don't think so. And I tell you what, because again, education is important for this. You got to make the community aware of what's going on without the hype.
Let's turn to Dr. Rossi, joining us via Skype right now. Doctor, how important was that photo of President Obama embracing the nurse who recently recovered from Ebola?
I think it was big, actually. I think it showed the world that we're not fearful. The president isn't fearful. I thought it was a very good move. The president's been criticized at times for optics. I think this is a case where the optics look fine. I agree with the mayor. I think the media has done a good job. The president is doing a fine job. And what's going to happen, I predict, is that this fear will be minimized or marginalized to a great extent. It's still a serious matter, of course. But I think we can deal with the fear if we have the right information to people.
All right, Dr. Albert, let me turn it to you for just a second. What do you think would happen to New York City if not one person had it, but all of a sudden 100 people came down with it? What would happen to our economy? What would happen to the fear people might have of traveling into the city?
Unfortunately, the fear factor would actually go through the roof. We live in a society that is over-medicated, hypochondriacs, in which we take quite a number of prescription drugs. And these millions of people are responsible. They are responsible citizens who take these drugs. The big fear factor is that we don't have, or have never faced in decades, a situation with Ebola. So this really has to be nipped in the bud. As the doctor explained, education is critically important. And what's also important is to minimize the fear factor, the Ebola symptoms are the same symptoms that you have with the flu, and the flu season is upon us. And again, education is critical to recognizing what could be an Ebola situation or could be just a flu situation.
Okay, doctor, I'm going to put your doctor hat back on for just a second and ask you a little bit about Ebola. Apparently, we are told that it's not contagious unless the person is actually having symptoms at the time.
Absolutely. The incubation period is from 2 to 21 days. You could only get, and let me repeat, you could only get Ebola if you were to touch or in contact with any bodily fluids. So,
would someone sneezing on you be enough?
I was going to say, if he sneezes close enough and it lands on your face or on your eyes or in your mouth, yes, you will get it, but the chances are very minuscule. You will get Ebola if you don't use proper techniques. And in this country, we train well how to put our gloves on, how to take them off, and how to protect ourselves. And even in the operating room, that's the reason this country has the least contagious process in the operating room, because we do care. I mean,
as a physician who could possibly see patients with Ebola, do you have any personal fears about it or trepidations?
No. Actually, this reminds me of the HIV virus when it came out in the early 80s, and it was a big hype. Everybody was very concerned about it. And if you do a comparison, HIV killed thousands of people. Ebola has, I believe, close to 5,000 people have died of it. But again, at that time, everybody was scared to touch somebody with HIV or talk to them, and it was crazy. Again, education is very important, and the government, my administration, we're going to be educating the community.
Okay, let's turn to Dr. Bart Rossi. Doctor, you've been listening to the conversation. A lot of this pertains to fear. I remember back in the 1980s, people were afraid to shake hands with people who had HIV or AIDS. I remember some of the photographers I worked with at the time would actually have two things in their hands so they wouldn't have to shake hands when interviewing an AIDS patient. Are we seeing that kind of hysteria here in the United States now?
To some extent, I think we are. I think there is a fear factor out there. But as psychologists say, to deal with anxiety and fearful situations, if you have the right information and you put things in perspective. For example, we drive a car every day, and it's very dangerous if you really think about it. We can then deal with the anxieties and the fears and not necessarily put it to rest, but at least go on and live our lives appropriately.
Doctor, do you think part of the problem is we have not been given a clear message from government saying we are going to take every step possible to keep our people safe? The people of America are our #1 priority. I haven't been hearing that from the Obama administration. I've been hearing that you don't have to worry about the virus, but I haven't been hearing definitive words from him saying, don't worry, every step possible is being taken to protect Americans. America first.
Well, I think that's a good point, Logan. I think that, we need leadership to make sure that we repeat ourselves. In this situation, we need to repeat the fact that this is going to be contained. We're going to do a good job. We're working night and day to resolve the problem. I think the president deserves some good marks on this, but as you say, I think you can't say it enough to folks because the fear factor is really quite dramatic here.
Albert, I heard Geraldo Rivera talking about this week. He said the president has kind of this languid persona where he's an intellectual, he's easygoing, he's cerebral, and sometimes we need somebody who's guttural, who's somebody who seems angry, somebody who's on edge, somebody who's going to take action. Do you see any dearth of leadership from the president when it comes to Ebola?
Well, what it is, he's really doing an overview, and as a president, he has to project that type of language. However, he has to indicate, or in some way, there's other layers of leadership with respect to solving this issue, in which you get down to, let's say, the state level, the town level, the city level, particularly the community level, get that same factual information to that leadership to be able to communicate to the community in a language and an attitude that they understand, to reduce the fear of an Ebola situation and to educate them, as the doctor pointed out earlier.
Okay, we're going to put your mayor hat back on. What do you think about what Governor Chris Christie did, imposing the mandatory quarantine for 21 days for people who've had contact with people who have Ebola?
I applaud him. I think this is the containment is the first thing we should be doing, and he's doing it. And follow up with the patients. Who else that patient had in contact with. And we saw that with the nurses. You had in September 30th, I believe, the first person that came to the Presbyterian Hospital in Dallas, he got infected. On the 4th, the first nurse got infected. On the 10th of October, the second nurse got infected. And you need to contain these people. And, after 21 days, if they're okay, send them home.
All right, and we pray for all of the people who were infected with the disease or have encountered people who were infected with the disease. When we come back, we're going to be talking about a 5-year jail term for a man who killed his girlfriend. Yeah, he admits it, and why some feel Oscar Pistorius got away with murder.